Hey everyone, it's Dr. Baird at Performance Healthcare Online. Today we're discussing 6 things that you should consider if you're thinking about knee replacement surgery. So, if you're watching this video, it's probably because somebody has recommended a knee replacement surgery or mentioned that it might be something that you need in your future. And I think the first thing to keep in mind is that the purpose of this video isn't to say yes, you need surgery or no, you don't need surgery. The purpose of this video is to get you to think about and answer questions so that ultimately you can decide if surgery is going to be the best route for you. So unfortunately, the all too common scenario that I see play out is that somebody goes to their doctor with knee pain, that doctor takes an x-ray, the x-ray shows some sort of arthritis, minimal to severe, and they might even use scary words. They might say you're bone on bone, and then ultimately jump straight to the surgery route. And so the main point that I want to get out of this is that the decision for whether or not you need a knee replacement should never be put on pain and arthritis or imaging alone. There are plenty of people who have knee pain that don't need a joint replacement surgery. There are plenty of people that have arthritis that don't need a joint replacement surgery. Not saying that they shouldn't be part of the things that you consider, but it shouldn't be what that decision is based off of. And unfortunately, there's a lot of doctors who recommend knee replacement surgery just based on those 2 things without considering all these other things that we'll talk about in this video. And the reason why it's so important is because surgery is really an all-in approach, right? They make it sound so easy. They just go in there, give you a new knee, you wake up, and you're feeling fine. But in order to replace that knee, they got to cut through muscle. They got to cut through fascia, soft tissues, nerves. And though that can lead to a whole other set of issues. There's a long recovery, right? So there's months of physical therapy to get your range of motion and to get your strength back. And so, in my opinion, surgery, joint replacement surgery, should really be the last option for somebody with knee pain. And maybe it is the right decision for you, maybe it's not, but I want you to take these things into consideration when you're thinking about it. So, first one is, how well are you functioning? So, how well are you able to perform your daily activities? So if you're still able to function pretty well and you just have a lot of knee pain, that's not a justification for surgery. And unfortunately, this is another thing I see all the time. I had a patient just the other day who was recommended knee replacement surgery for some knee pain. She is a little bit older. She does have a good amount of arthritis in her knee, but in terms of her daily life, it's not really impacting her. There's a little bit of pain when she walks, but she's still able to be pretty much 100% functional. So again, not saying one way or the other, but it's just something to consider. How functional, how much is this pain impacting my ability to do what I love? Number 2, what are your goals for surgery? So what do you need your body to be able to do to be happy? And so again, it's different for everybody. There's not a right or a wrong. If you just need your body to be functional, to maintain your mobility, maintain your independence, do things like walking, stairs, going to the grocery store, there are plenty of things you can do besides surgery to help you get to that point. Now, maybe you're somebody who's a little bit more active, who requires a little bit more of their body, who's been in pain for years, who has a fair amount of arthritis, who has tried physical therapy and some other things and hasn't quite gotten the results and is still fairly limited or very limited in what they're able to do because of this pain, then maybe that might lead you more towards surgery. Again, no right or wrong, but the question is, what do you need your body to do to be happy? And is surgery going to be something that gets you closer to that or further away from that? So again, no right or wrong. 3, will surgery fix the issue? So most people go into the surgery because pain relief is the issue that they want fixed. And again, a lot of times surgery is sold as this quick fix for knee pain, that hey, you come in, we'll give you a new knee, you'll walk out, pain relief is gone, or your pain is gone. And I think it's important to note that that isn't always the case. There's actually studies, and I linked one in the article that I'll put in the bottom of this video, that showed that about 20% of people who did a full knee replacement now have chronic knee pain. And so obviously those people who went into the surgery with the expectation that it would get rid of their knee pain, and now a couple years later they're still having the same amount of knee pain, are a little bit disappointed that they went the surgery route, because again, it creates there's long recovery, there's all these sort of issues. So again, it's important to, if you're going in with the expectation that the surgery is going to fix your pain, that's not always the case. So again, just something to consider. And number 4, are there other ways to fix the issue? So again, surgery should really be the last option that you try. And if you haven't tried other things, then I strongly suggest that you try to fix this issue or fix your knee pain without going the surgical route first. And so again, it's hard. This is a hard one because a lot of people will try maybe like 2 weeks of kind of some half-assed physical therapy and say that physical therapy didn't work, when in reality, if you've got a fair amount of arthritis or the pain's been around for a long time, this issue has been going on for probably, years at this point. And to expect just 2 weeks of some maybe good, maybe bad physical therapy to solve the issue is maybe a bit unrealistic. So that's another question that I would ask myself if I were in the situation, is have I really tried everything to solve this issue without surgery? And if I'm really trying to avoid surgery and that answer is no, I haven't, well then I'd probably try something else. And again, I'm a little bit biased, but I would say movement training and strength training, if you haven't tried that, you really should, because it can save a lot of people from surgery. I've seen it myself. All right. 5, what are the total costs? So obviously there's the direct cost of the surgery. Surgery is a pretty expensive route to go, especially right off the bat. But there are a lot of other kind of hidden costs that aren't always directly mentioned. So again, there's the cost of the surgery, there's the physical therapy after the surgery, there's the long recovery. So again, it's how many, are you gonna have to miss work? Are you gonna be able to collect a paycheck for the next 6 months? Are you gonna have to eat up all of your PTO? And if you use up your PTO, maybe you planned on going on a vacation and now you can't go on that vacation because you used up all these PTO. Again, these are just things to consider. It's not yes or not no. Maybe that doesn't bother you at all. You're retired, this doesn't matter. But for some people, there are a lot of indirect costs that should be considered, especially considering that there might be alternatives to fixing the issue without surgery. All right, and number 6, how well do you trust your doctor? So again, I hate to say it, but not every doctor has the patient's best interest in mind when they recommend a surgery. So I think it's important, again, just kind of ask yourself, do I trust the person that's making this recommendation? Are they making me feel pressured to get this surgery? Or are they very helpful, answering my questions, providing alternatives, making sure that I'm making the best decision for myself? And that's something that you really want to look for. Again, you should never do a surgery because you feel pressured to do the surgery. It should be something that you and your doctor kind of agree, hey, we've tried everything else, and it should be something you feel very comfortable doing and comfortable with the doctor who's going to do the surgery. So again, not saying they're all like that, but it is something to consider. You shouldn't feel pressured into a surgery. It should be something that you decide when you're comfortable. So that's really it. Those are just 6 things to consider. So to recap again, don't make this decision based on pain and imaging alone. You want to keep in mind all these other things in terms of how is the pain impacting your life? Have you tried other things? Do I want to go through that lengthy recovery of surgery? These are all things that you should consider. And again, there's not a right way, there's not a wrong way, there's not a yes, there's not a no. It's going to be specific for you. But at the end of the day, this should be a decision that you make for yourself. So if you do have any questions about this issue, go ahead and leave a comment down below. Send me an email. I do read them all. And again, let me know other ways I can help. The purpose of this video is to help people live active, healthy, and happy lives. And the more I know about what would be helpful, the more I can kind of create this content. So again, don't forget to subscribe to this channel or join our email list. I send all this stuff out directly to your inbox. Thanks so much for watching, and we'll talk to you soon.